Well, hello and welcome everyone to another session in the Solid Finances series. I'm glad you could join us today. Looks like we've got a big crowd with us here today. A couple of housekeeping notes before we get started. I'd like to thank our sponsors, which is going to be North Dakota State University and Montana State University Extension. We collaborate to bring this program to you at no cost. Also want to just remind you about our website, which many of you utilize to log in here today. We do keep our upcoming schedule there, including the schedule changes. We did move one session from December into February due to a conflict that came up there. So that information is up there as well. Also contact information for myself and Carrie Johnson, the two organizers. So if you've got a question, a follow-up, an idea for a session you'd like to see us cover in the future, please go ahead and send that information to us. And we also do keep recordings of our past sessions. I would say all of our sessions, but after a year or two, we do take down the old ones as the information gets outdated. Finally, today there's a couple ways you can interact with us. The first one is the chat window. You're certainly welcome to submit questions through the chat window to us, and if you do that, please make sure that they do come to me or host so that I can ask them to Dr. Johnson while she's presenting. You can also send it through the question and answer pod, and that will be anonymous. So no matter how you ask your question, we'll just say a question has come in, and we won't say your name over the air. So it is anonymous, and no one else will know if you send it through the question and answer pod. Finally, again, you all know the login information was there, but I also wanted to point out one thing. Some of you may have seen this through advertising efforts like the MSU Today calendar. You can actually sign up to receive a reminder email the day before each of our sessions. And if you do that, it's from our main webpage, and it's the lower arrow here of the two that you're seeing on the screen. And that will just get you a reminder email one day prior, telling you what the title is and a link to the resources, and also how to log into the webinar. So if you'd like to sign up for that, if you haven't done so already, please feel free to do that. Again, the upcoming sessions, the next two are going to be student loan debt related for both of them, and there is a lot of information out there about student loans. So we're going to cover 2 different weeks on this. We could probably do a series of 4 or 5 more, but we'll stick with 2 here and then move on. And Dr. Carrie Johnson, who's our presenter for today, will be presenting those 2 sessions as well. So with that, let me introduce today's topic is going to be Medicare, which I know is a hot topic for many folks, especially those that maybe are getting close to that magic age of 65. So Carrie Johnson is going to cover some of the background here for Medicare. And again, please feel free to jump in and ask some questions as we go along today. So Carrie, the floor is yours.
All right, thank you, Joel. So this, the information from this actually comes from a program we do here in North Dakota called Turning 65 Medicare Basics. So if you're turning 65, you know somebody who's turning 65, the information today it's a very general overview of Medicare. So there's a lot of information. If I'm going too fast or you have questions, definitely ask those as we get going. So to just get started, what is Medicare? Medicare, it really is, or what are we going to cover today? Sorry, I'm a slide ahead. We're going to talk about Medicare terms because there are there's a lot of terminology that you may not know. We're going to discuss introduction, so what it covers, what the costs are for you, and then how to sign up for Medicare, options for those who decide to continue to work once they turn 65, and also options for individuals who decide to retire before they turn 65. So President Lyndon Johnson signed the Medicare and Medicaid programs into law on July 30th, 1965. Medicare became effective July 1st, 1966. So it's the nation's largest health insurance program, and it covers about 44 million Americans. Medicare is health insurance for 3 distinctive groups of people. So those who are 65 and older, people under the age of 65 who have certain disabilities, and also people of any age who have end-stage renal disease. Medicare is administered by the Centers for Medicare and Medicaid Services, so CMS. When you're looking at any information about Medicare, if you want to make sure it is more generic and it's not a company trying to sell you something, it should have the CMS logo on it. And then enrollment is actually handled through the Social Security Administration. Planning ahead for Medicare is really important for those who are nearing the age of 65 for a couple of different reasons. So there are penalties that can be imposed on you if you don't act on different parts of Medicare on time. And then if you have other coverage through work, you can actually maximize your benefits by planning ahead with Medicare. So there are these different parts of Medicare. And what are they? So Part A is hospital insurance. So if you are an inpatient, if you get sick and you get put in the hospital, Medicare Part A is what covers that. Medicare Part B is what we call medical insurance. So if you go to the clinic, you have a checkup, you're not feeling well, you just go see your primary care provider, that is actually covered under Medicare Part B. There is Medicare Part C, which is Medicare Advantage plans or Medicare cost plans, and we'll talk about these in detail, what they are, what they cover, and what the difference is. And so Medicare C has some HMOs and PPOs. It's a little bit different than your traditional, or what we call original Medicare, which is Part A and B. So those combined, if you choose to, you can purchase this Part C instead. And then there's also Part D, which is really important. We in Extension and other service organizations sometimes will help individuals every year decide on their Part D or their prescription drug coverage. So again, we're going to go through all four different parts and what is covered under each and the cost to the individual for those. So when do you enroll in Medicare? So you have a 7-month window to enroll in Medicare. So 3 months prior to your 65th birthday, the month where you turn 65, and then 3 months after you turn 65. So that is your initial enrollment period to sign up for Medicare Part A or Medicare Part B. Signing up for Medicare Part B when you're first eligible is really important. So those 7 months are extremely important, or you will have to pay a late enrollment penalty. And you pay that enrollment penalty as long as you have Medicare Part B. So if you are a few months late and you are assessed a penalty, you will pay that penalty until you no longer have Medicare Part B. There are also some individuals that are automatically enrolled. So if you're already receiving Social Security benefits, you are automatically enrolled in Part A and Part B without any additional paperwork. You will receive your initial enrollment package, which includes your Medicare card. So the red, white, and blue card is kind of what we've always called it. This is kind of what it looks like. A few years ago, they changed this. It used to be your Social Security number with a letter afterwards. So that was a recent change where your Medicare number is no longer your Social Security number, which is really helps with security and making sure that people's identity is not stolen. So again, if you are enrolled automatically, you'll get this card about 3 months before you turn 65, or 3 months before your 25th month of disability benefits. So otherwise, how do you enroll? So if you're getting Social Security or U.S. Railroad retirement benefits, you will need to sign up for Part A, even if you're eligible to get it premium free, and we'll talk about that. You should contact Social Security about 3 months before you turn 65. If you worked for a railroad, contact RRB to sign up, or you can do it on their website as well at rrb.gov. While Medicare is administered by CMS, the Social Security Administration is responsible for enrolling most people in Medicare. The U.S. Railroad Retirement Board is responsible for enrolling railroad retirees in Medicare. So if you worked for more than 5 years with the railroad, previous Social Security payments were sent to RB. If you worked less than 5 years, they send your retirement payments to Social Security. So just a little bit of background on that. And then again, to enroll in your Part D, your prescription drug plan, that you will do that right away. And then also there's an annual enrollment period from October 15th to December 7th. And then if you do decide to change plans, the new insurance will then take effect January 1 of the following year. So when does coverage begin? So if you signed up before your 65th birthday, your Medicare benefits will begin the first day of the month you turn 65. So if your birthday is May 5th, you will start receiving Medicare benefits May 1st. However, if your birthday is on the first day of the month, your benefits actually begin the month prior. So my aunt, who I helped a few years ago sign up, her birthday's May 1st. And her benefits actually started on April 1st of that year. Just kind of this kind of quirk. So if your birthday's on the 1st, again, it goes back to the previous month. If you do wait to sign up until the last 4 months of your initial enrollment period, so if you kind of wait, your Part B start date will be delayed. So you'll see there on the screen the different dates when those do become active. So again, if you sign up the month you turn 65, it begins the month after. If you do 1 month after, you have to wait till 2 months after. So those are the dates there. And again, if you don't sign up in those first 7 months and you need to wait till that general enrollment period, you will be subject to a penalty, and the penalty is 1% per month or a max of 10% per year. And if you have questions on that, there are individuals out there that can help you kind of calculate that number to see what it would be. If you decide to remain on your employer's health plan and do not enroll in Medicare, so if you're still working, you will not get the penalty because you'll have creditable coverage. The group health plan will continue the coverage it provided before you turned 65. If you do work for an employer that has fewer than 20 employees, they are allowed to no longer offer you insurance, health insurance, and may require you to sign up for Medicare. But larger employers, so those with 20 or more employees, they are required to offer you the same group health plan that other employees receive. So just something to keep in mind if you're trying to decide which coverage you want, if you decide to do both, or you're going to delay Medicare because you're already paying a premium at work, and things like that. So again, you've got this dual coverage option. You're eligible to enroll during a special enrollment period if you waited to enroll in Part B because you or your spouse were working and had group coverage through your employer or maybe a union-based plan. So then you can choose to, once you no longer have that coverage, you can enroll during a special enrollment period. So that's really important to remember. If you have insurance when you turn 65 and you decide to delay receiving those benefits of Part B and Part D because they do have a monthly premium, then you do not have to pay that penalty for late enrollment. And again, if you decide to leave your position in the middle of the year, you'll just then receive a special enrollment period. Overall, you may end up paying a lot more for your health care. For example, you could end up having to send monthly checks to Medicare for your Part B premium and also pay your group plan through payroll deduction if you decide to keep dual coverage, your plan through work or your plan through work and through Medicare.
Carrie, we've had a comment or question come in. Maybe you could clarify, because I think it's still related to what we're talking about. And this is the comment. I was told that if you're still working, there was a document to submit indicating such that you could then sign up for Part B at a later time?
You know, I am not sure about the document. I know when you when you leave an employer and leave an employer plan, a lot of times you're given kind of a proof of insurance, right? That you did have insurance those months, and that would probably be what you need to submit. But I could definitely look into that if that person really wants to know for sure, and I can get back to them.
All right, thanks, Carrie.
I just know when I've left a job before, I get a sheet of paper saying what months I had insurance. So when I go to sign up for my next plan, it shows me which months I was covered. So good question. I will double check on that. Okay, so if you decide to decline your employer's group plan, for the same monthly premium and annual out-of-pocket cost, your employer's plan may cover a larger percentage of your healthcare costs than Medicare does. Okay, so it's something to just think about when you're trying to decide, do you sign up for Medicare or do you keep your employer plan? Employer plans also may include other benefits that aren't covered through Medicare, things like dental, vision, and other types of services sometimes are not covered under Medicare, but they might be covered under an employer plan. If any family member, so if you have a spouse or children who are covered by your employer's plan, they would lose their health care insurance by you deciding to go with Medicare. A lot of times your children are no longer on your insurance when you turn 65, but you might have a spouse. And if they're not 65 yet, they may then need to find insurance somewhere else. And then if you do change your mind, rejoining a job-related group health plan may not be possible. Also, once you enroll in Medicare, you can't make new contributions to like a health savings account. So again, that's another thing to think about. So using pre-tax income to pay for future health care may not be possible once you have declined that employer's group plan. On the other side, if you decide to retire before 65 and you lose your job-based health plan, when you do, you can use the health insurance marketplace to purchase a plan. You know, some states use the federal marketplace, and other states have their own state-based health insurance marketplace. So you can find that out typically by visiting your state's websites or the Affordable Care Act website. Losing health coverage qualifies you for a special enrollment period for the Affordable Care Act. So even if you leave in the middle of the year, you don't have to worry if it wasn't during the open annual enrollment. So it really, if you leave in the middle of the year or at the end of the year, it doesn't matter. Again, you get that special enrollment period. If you have retiree coverage, so some places do offer health insurance for retirees and want to buy a marketplace instead, you can, but there are a few downsides to doing that. So you can't get the premium tax credits and other savings based on your income because you are offered another plan, but you have denied it. So this is true only if you're actually enrolled in retiree coverage, right? So if you're eligible for but not enrolled in retiree coverage, you may qualify for tax credits and lower out-of-pocket costs on your household size and income. Again, these are all things you really need to think about and look into before making a decision. And then if you voluntarily drop your retiree coverage, you won't qualify for the special enrollment period in the marketplace because it was voluntary and you were able to keep that. So you'll have to then wait until the next open enrollment period. So thinking of those things as well before just dropping coverage, making sure you're eligible to sign up for something else. Okay, that was a lot of information, a short amount of time about, dual coverage. What do you do if you retire before 65? But now we're going to really dive into the Medicare parts. Oh, Joel, yes, something.
Can I jump in with a question before we
Mhm.
shift gears a little bit?
Yes.
So this is the question. My husband will turn age 65 in June. He is retired and is not currently receiving Social Security benefits. He is covered under so his spouse's health insurance from their employer. Does he have to enroll for Medicare Part A, or can he delay it until his wife stops working?
He can delay that because he's got creditable coverage under his wife's employer sponsored plan. Yes. So good question.
Thank you.
Now remember, Part A does not cost anything, so he could have dual coverage. Part B is the one that does have the monthly premium, is the one that you might want to delay, but definitely able to delay signing up for Medicare because he does have coverage. Great question. So now let's look at these different parts of Medicare. So Medicare Part A, again, we said before, this is our hospital insurance. It is premium free. So this is basic coverage that does not cost you anything every month as long as you earn 40 credits. So basically four quarters for 10 years. They do not have to be consecutive. So let's say you worked 5 years, you left the workforce for a few years to take care of young children and then went back into the workforce. You still then qualify for Medicare Part A. If you do have to pay a monthly premium, so if you worked less than 30 quarters, it is $471 a month. And then if you worked between 30 and 39 quarters, it's $259 a month. Again, it just really depends on how long you were in the workforce. It does cover hospital care, skilled nursing facility care. And when we say that, it's not any nursing home care. It is skilled nursing facility for, let's say you were in an accident or you need to stay in a nursing facility for a few months. It's to help you recover. It's not an ongoing stay. So that is different. Medicare does not typically cover nursing home, only for recovery. It also covers hospice and home health services. You will see as we go through this, different parts do cover some of the same things, but for different reasons. Not to confuse you anymore, but yes. So again, hospital care, what does it cover? It covers the things you'll see here on your screen. They include semi-private rooms, meals, general nursing, drugs that are part of your inpatient treatment, and other hospital services and supplies. You must be admitted as inpatient and not just for observation. So sometimes people get into, they'll receive a large hospital bill because they weren't admitted as inpatient. So again, due diligence, unfortunately, we have to sometimes check on how we were admitted to the hospital to make sure it's being covered. What's not covered is private duty nursing, a private room unless it's medically necessary. It doesn't cover television and phone in your room if the hospital has a separate charge for these things, or personal care items like razors or slipper socks, things like that. So what does this all cost? You have an annual deductible of $1,484, and then the cost to you while you are in the hospital, days 1 to 60, nothing. It is covered 100%. Days 61 to 90 is $371 per day. And then days 91 and beyond is $742. So a benefit period, and all these costs are per benefit period. And this is the way Medicare measures your use of hospital and skilled nursing facilities. So a benefit period begins the day you are admitted as an inpatient to a hospital or skilled nursing facility. The benefit period ends when you haven't gotten any of those services for 60 days in a row. Okay, so you can have more than one benefit period in a year. So if you go into a hospital or a skilled nursing facility after one benefit period has ended and a new one begins, these numbers reset themselves, okay? You must pay the inpatient hospital deductible for each benefit period. So that deductible, I think I might have accidentally said it was annual, but it is per benefit period. And there is no limit on the number of benefit periods that you use, okay? Now you'll see here all costs beyond lifetime reserve days, and what lifetime reserve day is in Medicare. There are additional days that Medicare will pay for you when you're in a hospital for more than 90 days. So you have a total of 60 reserve days that can be used during your lifetime. And for each lifetime reserve day, Medicare pays all covered costs except for a daily coinsurance. Okay. So again, these are all benefit period, and a benefit period is day one that you were admitted, and it ends after you haven't gotten any care for 60 days in a row. So I've mentioned skilled nursing facility care. What is that? What exactly does that mean? What is covered? So services listed on this slide are included in those skilled nursing facility care. You must have been admitted in a hospital for 3 consecutive days or longer to receive benefits. These benefits cannot be used for custodial care. So again, it has to be due to a medical reason and not for ongoing nursing care. So everything on your screen here will be covered. So I always think somebody who's older, who like my grandmother fell, broke her hip, and after surgery, after she'd been in the hospital for a few days, instead of being released to go home, she was sent to to a nursing home for a few weeks just for some care to help in her recovery, and then she went home. So the idea is that you're not staying there forever, but just there for some recovery and some assistance. So in a skilled nursing facility, days 1 to 20 are nothing out of pocket. Days 21 to 100 will cost $185.50 in a copay. And then after 101 days, 100% of the cost is up to the patient. So the hope is that you would be released within 100 days. Medicare Part A also covers hospice care. It won't cover any of these if you choose treatment intended to cure your terminal illness and or related condition. But for individuals who are facing end of life, who choose hospice care, Medicare Part A does cover that. It also covers respite care, which is temporary care provided in a nursing home, like a hospice inpatient facility or hospital, so that a family member or friend who's the patient's primary caregiver can take some time off and rest. So Medicare Part A will cover that form of care again, so the caregiver can have a little bit of time off as well. So for hospice care, costs nothing for the patient. There is a copayment of up to $5 for each prescription drug and other similar products for pain relief and symptom control. Again, not for cure, but for symptom control and for pain. If you are put into hospice care or have a family member put into hospice care, that is what the cost out of pocket would be. Home health, again, also covered under Medicare Part A. Medicare doesn't pay for a 24-hour-a-day care at home, meals delivered to your home, homemaker services, or personal care, but it will cover intermittent skilled nursing care, physical therapy, speech language pathology, or continued occupational services. $0 is the out-of-pocket costs. There are some costs for durable medical equipment. Things like a wheelchair, a walker, maybe a hospital bed that needs to be placed in the home to make things easier. There is a 20% co-insurance for those items as well. Okay, so that was Medicare Part A. A lot is covered under Medicare Part A, as you can see. And again, that is premium free as long as you've worked 40 quarters. And I'm not seeing any questions on Medicare Part A. Maybe pause just a second here before moving into Medicare Part B. Okay, so Medicare Part B is also referred to as medical insurance. This is the part of Medicare that pays for things like doctor visits or when you get sick, just going in for checkup, those types of things. So there is a deductible of $203 per year. And then the premium is based on income. So I'm not going to read them all to you, but typically the majority of individuals, we say their premium is probably going to be that $148.50 every month. And that is, you know, many retirees make less than $88,000 or $176,000 if they're married filing jointly. But in most cases, if you don't sign up for Part B when you're first eligible, this is the one you'll have to pay that late enrollment penalty. You'll pay this penalty as long as you have Part B, and your monthly premium for Part B may go up 10% for each full 12-month period that you haven't signed up. So if you wait, let's say 2 years, you wait till you're 67, you didn't have any insurance, you weren't covered anywhere else, you'd have to pay an additional 20% monthly premium. And again, that percentage is based on how many months that you wait until after you're eligible. So what is covered? Medically necessary services. So services are supplies that are needed to diagnose or treat your medical conditions and that meet accepted standards of medical practice. Also preventative services are covered. This is healthcare to prevent illnesses. So things like the flu. So getting your flu shot or detecting cancer at an early stage when treatment is most likely to work the best. So going in for your annual checkups is really important. When you do get Medicare, that's one of the first things they tell you to do is schedule your first appointment with your primary care provider. So what are your costs under Medicare Part B? You have your monthly premium that we talked about. And then you have a co-insurance of 20% of Medicare approved amounts. So very similar to private health insurance, a lot of times there's no copay, it's co-insurance, so it's 20%. So of doctor services, so this includes most of your services, outpatient therapy, and also durable medical equipment. So we're going to talk about Medicare Part C. So I like this picture. This actually comes from AARP. This is in their Meet Medicare booklets, and that is one of the resources that I provided for today's session. To me, it does a really good job of kind of showing the difference between original Medicare, and we call original Medicare is Part A plus Medicare Part B. So that is what original Medicare is. And you can then add a supplement insurance plan, which is called Medigap, and we'll talk more about that in a few slides, and also Part D, your prescription drug coverage. Whereas Part C is a Medicare Advantage plan where it kind of bundles it all together. It combines Parts A and B, or there's also Medicare cost plans. We'll talk a little bit about that as well. But these two, Medicare Part C, so your Advantage plans, they also might include things like your prescription drug coverage. They may also cover vision and dental, so some things that original Medicare does not cover. So your Medicare Advantage plans, again, they're offered through a private insurance company. They contract with Medicare to provide you with all Part A and B benefits. It includes HMOs, PPOs, private fee-for-service plans, special needs plans, Medicare medical savings account plans. So there's a lot of different plans you can get. Again, offered through a private insurance company. You would pay them and no longer be paying CMS. Some, again, include that prescription drug coverage. If the plan does, you are required to take the coverage. You can't. So if that Advantage plan has prescription drug coverage, you can not then pick another Part D plan, so a prescription drug plan, a separate plan. Whereas, original Medicare also does not have any out-of-pocket maximum. So that's another thing to think about, is that these Medicare Advantage plans do have by law, they have an out-of-pocket maximum of no more than $6,700 per year. And once you hit that limit, the plan then covers all of your expenses. So each type of plan has specific rules and exceptions. So some of these plans provide Part A and Part B coverage, while most others might only provide Part B coverage in Medicare cost plan. Some also include, again, Medicare prescription drug coverage. If they do, you then actually have the option to take this or decline it. So that's the difference between an Advantage plan and a cost plan. You can join anytime the plan is accepting new members, and you can leave anytime and return to original Medicare. So if you decide, I'm going to try this Medicare cost plan, and you don't like it, you can leave at any time and go back to original Medicare. So I get I've had a lot of questions. I used to do, when I was in a county office, some one-on-one with people and help them make the decision as to what was best for them. So they would ask, well, why would I choose this over this? So here's some reasons why Part C, choosing that, what the difference is between original Medicare and Part C. So the cost, premium, deductible, and coinsurance. Again, Part C is similar. Out-of-pocket spending, there is no limit for original Medicare. Part C, there is a limit. Prescription drug plans, with original Medicare, you have to get a separate plan. In Part C, offered in some of those plans, same with additional benefits like dental and vision. Here's kind of the sticky part, is which doctors accept certain insurances. So original Medicare, you can see any provider who accepts Medicare, whereas Part C, you'll want to find an in-network provider depending on which plan you choose. And then specialists, you can go to any specialist who accepts Medicare under original Medicare. And on Part C, you must most of them require a referral from your primary care provider. So now we're going to move into Medicare Part D, which is prescription drug plans. Each plan. Oh, yes.
Before we jump to Part D, can we catch up on a couple questions that have come in?
Yes, please. Yep.
Okay. So the first question here was related to what you were just talking about. Is there a limit on the number of medical equipment items that are covered by Medicare?
I don't think there's a limit on the number. You're speaking durable medical equipment like wheelchair, walker. If it's prescribed, Medicare will cover it, and it costs you the 20% out of pocket.
Okay, and the other one moves back to the tail end of when you were talking about Part B. If I'm employed and have insurance coverage through my employer and do not retire until I am age 68, can I enroll then with no additional penalty?
Yes. Yep, as long as you keep your employer coverage until you retire, you absolutely can then at 68 pick up a Medicare Part B with no penalties.
All right, that's all the questions at the moment.
Great questions. All right. Oh, and I actually see, okay. So Medicare Part D, this again is your prescription drug plan. A formulary, so each plan company has a formulary. When I say formulary, a lot of people give me that deer in the headlight look. This is a list of prescription drugs covered by that plan. So that's all we're referring to. Sometimes it's called a drug list. These change every year. So FYI, you may be perfectly happy with your prescription drug plan and it's covering all the medications you're on. But if the following year, they change their formulary and you don't double check, you may no longer be able to get that prescription, or you have to pay 100% out of pocket to get the drugs that you need. So something to always think about. There is a late enrollment penalty for prescription drug plan coverage. Again, if you have other coverage, you're fine. If you wait till you're 68, 69, as long as you're covered under another plan, you do not have to pay that penalty. One thing I want to mention for 2021 is the insulin savings through Part D senior savings model. So starting January 1st, depending on the prescription drug plan, the insurance company, you may be able to get Medicare covered, that coverage that offers broad access to many types of insulin for no more than $35 for a 30-day supply. This is huge. A lot of people would go into what was called the donut hole because insulin is so expensive. So they would, spend a few $1,000s in the first couple months and then have to wait until they spent out, they kind of used all their benefits up. So this is a big thing. So if you are reliant on insulin, it's really important to make sure to put those drugs, those insulin, the type you use, into the prescription drug list when you're signing up for Medicare Part D, and it will tell you if it's covered and if it is covered at that $35 for a 30-day supply. Right, so there is a question, how does Medicare choose preferred pharmacies for each area? That I am not sure how they choose them. I know when I help people sign up, you do put in the pharmacy, and each pharmacy, the cost is a little bit different too. So they also get to set their own prices, which is, you'd think every pharmacy would be the same, but it's not. So I do not know how they choose which ones are preferred and not preferred. Oops, sorry about that.
And Carrie, there's a couple more questions too. Another one is, can you change your Part D or Part C companies annually during a sign-up period?
Part D is during annual enrollment, October 15th through December 7th. So that is, yes, you change that every year if you'd like to. Again, I always tell people, look at it anyway, just to make sure it's still covering what you need it to cover. And Advantage plans, I'm thinking they do have an annual enrollment. Yes, so it's open at the same time for Part C. For Advantage plans, you sign up for those through Medicare.gov as well.
All right, and there is one other question. My spouse turned 65, but she is covered under my employer plan. Can she wait to enroll until I retire and then enroll with no penalty?
Yes. Yep. As long as you have coverage, does not matter if it's yours or your spouse's. So yes, they can wait.
And then a final question here. I'm in a Blue Cross Blue Shield Medigap that is no longer offered. If I go to Medicare Part C plan, will they have to take me back to the original Medigap that is no longer open to new members?
Yeah, I'm looking at that question right now. I'm wondering, if I go to a Med C plan, will they have to take me back to original Medigap? So are you thinking original Medicare? Or you have a Medigap plan that's not open to new members? And we're going to talk about Medigap right now, which is different than Medicare Advantage.
Well, let's hold that question for the
Yeah.
moment. Let you go through this, and if the person that submitted it wants to clarify, we'll catch it after the Medigap discussion.
Thank you. Yes. So yes, now we're talking about Medicare supplement plans, which is Medigap. Different than Medicare Advantage, different from Plan C. So Medicare supplement, these help pay healthcare costs original Medicare doesn't cover. So the big difference here is that you keep your original Medicare, Part A and Part B, and then you have this supplement plan through a private company that picks up your copays and that 20% that Medicare doesn't cover. So that's the difference between those. So Medicare Advantage really is a healthcare plan. This is a supplement where it picks up whatever insurance or original Medicare doesn't. So you'll want to shop around for coverage. The only way to get this is through a private insurance company. You do not, you cannot do this through like the Medicare.gov website, like you can with Part C and Part D plans. Again, the biggest difference here is cost, but you'll see here, so coverage depends on the plan you choose, A, B, C, D. All right, but all A plans offer the same coverage. All B plans offer the same coverage. So when you're looking at these Medigap plans or Medicare supplement plans, whatever the company calls them, if you go to Blue Cross Blue Shield, you go to Sanford Health Plan, and they both have a B, but one is more expensive than the other, they're both covering the same thing, okay? One quick note, in 2020, Medigap plans sold to new people with Medicare won't be allowed to cover Part B deductibles. Because of this, Plan C and F no longer are available to new Medicare people, new Medicare enrollees. So I have these on here so people who already have Medicare, they can still choose it. But those who were new January 1st, 2020 or after cannot get C or F plans. And an insurance person who sells these plans will be able to explain this as well. And yeah, you can use your local insurance agent and they might be able to help you a little bit, but being an informed consumer and knowing what they cover is really important. And there is a reference in the resources that explains what each one of these does cover, like what percentage and that type of thing. So to qualify for these Medigap plans, you must have original Medicare Part A and B. If you have a Medicare Advantage plan or a Medicare cost plan, you can apply for Medigap, but you have to leave those plans before this policy begins. You cannot have both. You do, again, pay that private insurance company a monthly premium for this policy in addition to your Part B premium that you pay to Medicare. A Medigap policy only covers one person. So if you and your spouse both want the same plan, you have to each enroll separately. So it'll be separate policies. It's one thing with Medicare, you can't do like a family plan or a spouse plan, like your typical employer sponsored insurance. So you buy these through your insurance company. They have to be licensed to sell supplement plans in your state. So, you know, with the invention of the World Wide Web and people selling insurance online, just be really careful, make sure that they're eligible to sell insurance in your state. When a person is at least 65 years of age and their Part B becomes effective, they have 6 months of guaranteed issue where you can choose whichever Medicare or Medigap plan you want, and the company must accept them. So they cannot underwrite and cannot charge them more than a person who's the same age who is perfectly healthy. So if you do have health issues and you think, you know, even with original Medicare, I'm going to have some expenses and I'm going to get a Medigap policy to kind of pick up some of those other expenses, you have 6 months to enroll and have it guaranteed issue. Now, as long as you're paying your premiums on time, it's guaranteed renewable. So they cannot kick you off if you have health problems. So again, really important within 6 months. And then also guaranteed renewable. So as long as you're making your premium payments, you're paying on time, they cannot kick you off the plan. Some Medigap policies sold in the past covered prescription drugs, but now anything sold after 2006 isn't allowed to include any prescription drugs. So if you want drug coverage, again, you must join a Part D plan. We've had a few questions throughout doing this presentation where a lot of people ask, well, what if I travel? People are staying healthier longer, right? When they turn 65, they want to travel, they want to enjoy the world. So if you have original Medicare, you can travel anywhere in the US and its territories and get the medical care you need from almost any doctor or hospital. If you have an Advantage plan, they may not cover your care while you travel in the US unless you need emergency or urgent care. So if your plan does allow you to see providers that are outside your network or area, it just will cost you more. So again, if you travel a lot, that might be something to think about when you're deciding which parts of Medicare to purchase. But you can always contact your plan to see what rules apply when you're traveling within the US. If you'll be traveling to a foreign country, Medicare will not usually cover your medical care. However, there are limited cases where original Medicare and Advantage plans must cover your medical care you get outside of the US. But again, it's not guaranteed and it's very specific circumstances. Some supplement insurance plans, like those Medigap plans I talked about, do provide insurance for foreign travel. So like those Medigap plans C through G, M and N, I know all these letters thrown at you, cover 80% of the costs abroad for the first 2 months of a trip with a $250 deductible, and they'll cover up to $50,000 in a lifetime payments. So again, just thinking about that, if you are planning on traveling with the US or traveling abroad, which plan is going to work best for you. If you need assistance, there is a state health insurance assistant program, CHIPS. There's usually one in every state. In North Dakota, we have SHIC. They might be called something a little different. I think in South Dakota, we were SHINE. So this website that I have up here actually has the national network, and you can click on your state to find contact information, because there are volunteers out there that will help you through all of these questions. Help you make an informed decision so you don't have to memorize all these things. That's kind of what we do as volunteers, is we learn all this and we help the consumer make that decision. So never tell you what you should do, just display your options and let you know, here's this plan, and then if you're looking at Medigap, here's some insurance companies that do provide it in your state. Okay, I tried to take questions as we went. Let's see what other questions we've got.
So we've just got a couple, and let me make a quick announcement too. For those that may have to leave, in the chat window, I put our evaluation link. So if you would take a moment to complete that, for those of you that stay on until we end it, it will automatically take you to that web address. So, but we do have another question. One is, so you could have Medigap on top of Part C if you are newly signing up?
No, you can never have Part C and Medigap. You can apply for Medigap and wait to see if it's past the 6 months, wait to see if you're approved, but you have to cancel your Part C before your Medigap begins.
All right, and then we did get a clarification on the question we were working on earlier. It is a plan that closed to new members last January. They are no longer taking any in that plan. I think it is Blue Cross Blue Shield Part F. You talked about you can go from Medicare Advantage plan and then back. Would this be true if the Medigap isn't taking new members?
Ah, there you go. Okay. That is a great question that I'm not sure I know the answer to. I'm just going to be completely honest. That is kind of one of those very specific questions. I would check if it's Blue Cross Blue Shield, I would check with them. I apologize not knowing that answer. It is a very specific, and I don't want to give the wrong one. Sometimes we just have to know that we don't know the answer to everything. But if need be, we can do a little digging. If you email Joel or I would be happy to do a little digging on the backside too.
All right. Well, it looks like we've gotten through all the questions that we've got there today. So thank you, Carrie, and thanks everyone for sending in all those great questions. Obviously, there's probably some more out there. Please take a point to look at the resources that Carrie prepared for today. Those are at the website, same link where you logged in today. And then mark your calendars for the next 2 weeks here. Dr. Johnson will be back with us talking about student loans in 2 different formats. So thank you, everyone, for joining us today. And I hope that you can join us again next week.